Hi, this is Dr. Bill Wyatt again with the American Orthodontic Society. And this afternoon I want to talk to you about some problems that people write back, and we read some of the comments and everything, and they ask a lot of questions about things that could be answered by just thoroughly studying the videos that we have put out. But I want to cover something here that's in adult orthodontics, and this thinking about your diagnosis. Somebody walks in and they want to see what can be done with their teeth or something like that, and you've got to sit down and just explain to them what can be done and how you could do it and stuff like that. If they're really interested, then you do a complete workup on them. And so all these things that I'm going to show you tonight, you can go back and look at the complete case. I've got it, and thousands of people have looked at it. So anyway, let's get in here and see what I was thinking about when we started the case. So I'm going to touch this and get this. A real nice lady, and these are pictures that we took after we finished the case. But she came in, and this is her smile after we finished. And here is a mirror shot. I just took a mirror in the person's mouth, and it goes right along in here. And this is the reflection of the mirror on these teeth up here. In other words, I can see how the bottom teeth are meeting the upper teeth right here. And if you've got some humps in here, like on some people's teeth, you need to reduce them and then make a kind of a shelf down there where they touch against that. That's just my thinking. Now, I didn't finish this out good right here. This tooth is turned a little bit right there. It could be better than that. But that's what's underneath here. And when you look at the person, you don't see up underneath there, but you can stick a mirror down here and look in the mirror, and you'll see this, where these teeth meet the lower anteriors meet the upper anteriors. And you need to have some kind of retention that will hold these lower teeth in place. And you need to smooth this out sometimes to make it where the tooth will stay in one position. Let's go on to the next the picture here. Now, just say somebody walks in and you set them down in the chair and you look in their mouth. That's all you've got to see. Can I do something with this case? Can I help this person? That's what you want to know. And the more you learn about orthodontics, the more you learn that you can help them. Now, this lady is in her late 40s and she gets into 50, and so we've got an adult here. And some people come in, they ask me questions. I went to somebody and they said, well, you're 25, your teeth won't move. This is a big mistake. Maybe that person was taught that that was right, but it isn't right. You can move your teeth as long as you're living. And I'm 94 this month, and I could go in and move my teeth if I wanted to, and the bone would go with them as long as I'm healthy enough. So let me look at this model and see what we can do. I know how to open bites. We work off of our 6-year molars. We put a arch wire in going up like that, and we put regular braces of brackets on these teeth, and we put a little arch wire in there running between them, a flexible wire, and we take this intruding wire, bring it down and hook it to this, and it will elevate these teeth. and the force that it pushes up here, it's going to push down on your back teeth of the molar that we put that on. And you look here, we look, we've got lower anterior teeth, you can hardly see them. So the lower anterior teeth are way up in here. We'll see on the side here in a few minutes. Can you level the lower anterior teeth? You certainly can. I mean, you can bring those teeth down. And you may have to put a block in there or something like that to open it to start with to get it going down. But you watch the vertical dimension of this face. Now there's one thing you've got to know. Whatever force you've gone up in this direction, it's going down in that direction with the same force. In other words, you're going to extrude your molar while you intrude these upper anterior teeth. And you're going to extrude this molar back here while you bring these lower anterior teeth down. Now, all this is going through your mind, and if you've done this and you know it'll work, you can tell that person with confidence that I can open this bite. If you've never done one, you don't really know whether you can get it or not. So you've got to get in here and start out on people with deep bites and things and work with them, and you can open anybody's bite. I don't care how old they are or where you are. I've been in a lot of places in this world, and everybody wants to look good and they want their teeth done right. There's so much war and mess going on these days, you can't think about your teeth and looking nice. But anyway, you can do that. Now I want to kind of erase that, and I want to go on to the side. Now there's where we brought those teeth to. We raised these teeth up, and we worked off of the molars back here, and she chewed hard enough to where these molars did not move at all. You're using the muscle structure in your face here to hold these teeth in place while your arch wire that's up here is picking them up. It's putting just as much force on this to go down as you have to go up over here. And the same is as much force going down on these. This molar here is going up. But these two molars run into each other back here. And we can do things. If you're afraid of opening the vertical dimension, and that makes people look terrible if you give them too much vertical dimension, you can put a bonded block on top of these teeth back here, and I'll guarantee you, you will bite on that block so much till you will not elevate or increase the vertical dimension of the face. If you don't think this block will hold it there, put about a 2 or 3 millimeter block on your teeth, and you see what you do. You will bite on that thing till you just, I mean, it's past your freeway in there, and you're hitting that thing all the time. So you put those on there for high angle cases. All right, for this case, it's not high angle, and the molars, she's biting on them hard enough to where we intrude these teeth, and we intrude these up here, and we end up with them looking great. Now this is going through your mind, and I can do that. If you've done it, you know good and well you can do it. And so you tell them, unless they've got some ankylosed tooth, then that you could crack loose and still do that. So now let's go to another bite here. On this side, this lady's got a big gap here, and we had, if you look at x-rays, she's got a wisdom tooth up here, and I think she had something down here, and say, can you straighten this tooth out? You're mighty right you can. I don't care if she's 50, 60, 70, 80, or 90, we could straighten this tooth up, and then we can pull it up in this direction. What we do, we come over here and we put a arch wire in there, and it's got a deal going off like that. You put it through the tube of this tooth, and this arch wire will tend to pull the root in this direction. But you have to tie this back, and this has to be tied on the other side of the mouth over here, and it will bring the root forward. Otherwise, it would take the crown back like this and leave a bigger gap in there. If that's what you want, then you just put this activation in here, and it'll pull this root like that, and it makes the crown go distal like that. I know how to do that, and I can do it. Now, these teeth have been closing and wearing in various sites, and we've got what we call a class 2 division to these upper anterior teeth. See, this one is button, the lower anterior is right down here. So we've got a little class 2 problem on the case too. Can we correct that? You bet you can. You can do that. Now, this tooth right here, we are going to drag it up into this spot right here, but we're going to bring this back part of the way, so this tooth will only come to about along there. And then we'll get the upper one coming in behind it, the wisdom teeth. If you've got good wisdom teeth, use them if you've got room in there. If you don't have any room at all, you have to eliminate them. But try to use the wisdom teeth. Now let's look at what happened when we go back on that case, this case again. And here we'll show it. There we have raised these teeth, we lowered these teeth, we brought this back and lined it up in proper place right there, like that. And so we were able to do that. We knew we could do it, and so you could say, yes, I can. I mean, you're just talking to yourself here, say, I can do that, I can fix that up for her. And so you do. Now on the other side of the mouth, we've got a wisdom tooth coming in here, and we want to close this space up over here. Now we would like really to open this bite. Now look at this bite right here. You see this tooth coming up there. I'm going to erase that so you can see it. This lower tooth hits this upper tooth, and the upper tooth is tilted back like that. And this is what we call just a kind of a locked bite back here. She can't bring her jaw forward. So people like this frequently, well, not many of them without any problem, but they'll have a temporomandibular joint problem, because every time she bites to here, it will kind of shove the jaw in a distal direction, and you've got your condyle up here in the fossa, and it'll push it backward, and it pushes it into the retrodiscal tissue, and it's highly vascular, and you get it inflamed, and that's where you have lots of pain back here. She was not having any difficulty with that, so deep bites don't necessarily make you have trouble, but people that have them and they're inflamed, get swelled up back here, and they hit it all the time they have it. You should examine everybody you work on. Put your fingers up here in front of the ear right here. Open your mouth, move it back and forth, and you can feel the condyle in here. If this is irritated and sore, the person won't let you really touch it. If you can find out exactly in here where the problem is, and you correct that before you start your orthodontics, really. You have to put in a splint, a forward repositioning splint. If you're one of these people that says, well, I don't have very many people that's bothered with that, I'm just going to ignore the temporomandibular joint. This is a bad mistake you're making, because there's a lot of people that have trouble with it. You get hit in the jaw here, shows your chin back, you don't have a mouth guard in, bangs your condyle into that tissue and damages it or irritates it, it swells up, they have TMJ problems. And people doing orthodontics, some of them believe that orthodontics doesn't have anything to do with that, and that's about as stupid a answer to that question as you can get. If you work with the teeth, you're going to have some effect on the jaw joint up here, and I know that for being a fact. Okay, so we got the possibility, so I checked her out, but she had nothing wrong there. So I said, okay, I can straighten these teeth out. That gives you some room. We'll bring these down, these up. We'll open this bite, and I'm going to pull all three of these teeth up. I'm going to straighten this cuspid up in here, and we'll have these molars coming in like that, and this one back here, and I'll use the back part of this one to catch the upper wisdom tooth that's coming in up here. Can I level this? This tooth is over erupted. We'll level it out. We'll do that with an arch wire, picking it up. And as we bring these teeth forward, we'll put them under it, and it'll level this up. And so in my mind's eye, I'm going to look at that side after I have done this, and there's where I come out with. I can do that. And if you do it time after time, you don't have any doubt but what you can do this. Now, these roots aren't in the gum good enough here. She's wearing this down somewhere or another. She had to redo this crown right here, and this is the, now this was the gap that we were looking at a while ago. I'm going to go back there and you look at that. Here's this tooth leaning over, here's this tooth. We brought these teeth forward. Now look at this. They're up there. And then the wisdom tooth is coming in back here. This is the second molar, and we had a bicuspid out down here, but we didn't have up above. And so this molar is actually occluding over half of a molar and half of another molar going back. And now this wisdom tooth will come in back here, and I'll leave enough of it protruding back here to catch the upper wisdom tooth, and we'll save it. So this is all in your mind. You don't have to explain everything to the patient, but it's pretty good if they know you can do this. And you know this is a 48 or 49-year-old lady, and we were going to work into the 50s and doing this. All right, let's go to the next deal, looking at the lower anterior, and we're going to bring all of these teeth up, and we'll bring this back some. We're going to intrude these and expand this area down here, and we'll pull this tooth back. I'm going to straighten it up, and I'm not sure whether there was one place she needed an implant when we got to it. I think it's right in this area here. So let's look at her lower jaw after we straighten that out. Now we straightened this up, and I bonded a flexible wire to these teeth out here just to ensure they stayed that way. And this, I think she worked on and crowned some of these teeth over here and fixed that up, made it look a lot better. But we could fix that, and we could do that. And so that you just thinking in your mind, yes, 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 I can help you if you want it. Here's the upper teeth. These teeth were worn down where the lower teeth went in here, and they were biting on that. Now I'll raise those and brought them forward. We closed the space over here and over on this side. Let's look at what we did for that. And there is the upper. In other words, we widened this out. We brought it out here. We gave her a beautiful smile when you see teeth back in the back of the mouth. And this left this gap open because the upper wisdom tooth is going to come down and hit this tooth, and that'll keep it from coming out. And she needed really one lower implants when we got through with them. Now, here is the lady after we finished. Of course, all these pictures were taken. The vertical dimension of the face in here is almost ideal. And we intruded these teeth and intruded these, and we didn't raise or move these molars hardly any against one another, and the face turned out and it stayed like it was. If this was a high angle case, I would have put those blocks back on the back, and that would have made these molars even intrude them while you intrude the molars while you're intruding the upper and the lower anterior teeth too. So that's adult orthodontics. I've gone to some of the dental schools. I don't know this is true in a lot of them, but they tell me that in the one out of the school I went to, the orthodontic department said we don't do that kind of adult orthodontics. Now this is ridiculous. I mean, there are thousands and thousands of adults that have money to pay for doing orthodontics, and we make a drastic mistake. You ask an orthodontist, well, what do you charge to straighten teeth? And he gives you an answer. That's about as dumb as driving your own automobile and it breaks down and you pull it into a garage and say, what do you charge to fix a car? Well, nobody just says give you a solid figure. They figure out everything they're going to need to do, and then they give you a figure. And that's the way adult orthodontics ought to be done. You should be compensated if you know how and you can do the job. So I'm going to hush up here and go ahead. This is the lady after we finished, and she's over 50 years old, and she had to put a crown back here. But we took this lady with all these gaps and tilted and messed up teeth, pulled the back teeth to the front. We didn't take out a single wisdom tooth. We used all of them to some extent and brought it back in. And you can do that, and orthodontists all over the world. What I'm concerned about is doing super good orthodontics wherever you are. I don't care whether it's in the United States or in Timbuktu or wherever it is. We get letters from people, and this video stuff has made it possible to reach people anywhere you're on the internet. You can pull up these videos, and if you want to go over them, you just look at it. You pull up and you get a little red line, and you go backward and forth in there until you see exactly how we did it and what we did. I'm not trying to hide any part of it from you. And I know we ought to teach dentists in school what can be done. If they don't know you can do that, then they're going to say, well, we'll have to put an implant here, we'll have to put a bridge, whatever it is, and do all this. If they know what can be done, they might do it or find somebody that will. Now, if you're out there and you want something done, and they write me saying, do you know anybody that will work on my teeth and do this? And naturally, I do not know anybody like that. But take the video to them. Say that we've got videos on nearly everything you think about in adult orthodontics, and also going in the other direction. So thank you for watching. I hope that this reaches people. I'm just concerned that everybody that messes with his teeth, whether you're an orthodontist, a regular dentist, or you're a pediatric dentist, or you're a medical doctor, and you can't figure out how the TMJ works, we've got cases showing you how that does too. So I'm going to hush and thank you for watching, and I hope you'll join our channel whatever you would call this. And I want to, as long as I'm able to pass on this information that I know is correct as best I know. If I'm wrong, tell me and show me where I'm wrong, and I'll check it out. And if I'm wrong, I'll tell people. I don't care. So I'm going to say goodbye, and I hope you'll get something out of this. I'm going to close up now. Good night.